Right, as we speak about COVID-19, a national survey conducted by a leading pharmaceutical firm and advocate for mental wellness has revealed a significant increase in psychological and emotional stress among South Africans as a result of the COVID-19 pandemic. The survey has revealed that South Africans' levels have shot up by 56% since the start of the pandemic. We now talk to Abdurahman Kenny, mental health portfolio manager for Pharma Dynamics, joining us via Skype. A very good afternoon to you, Mr. Kenny. Thank you so very much for being with us here on SABC News.
Good afternoon, Flo. Thank you for having me.
You're most welcome. We understand that the stress levels have gone up during particularly the lockdown, the harder sort of lockdowns, which obviously is now continues. What are the trends, for lack of a better word, have you picked up thus far?
So we did, like you mentioned, we did a survey where we interviewed various individuals from all over South Africa. And the trends that have been picked up is many of them have been complaining about increased levels of anxiousness, feeling frustrated, depressed, and a significant 6% have contemplated suicide. So from Dynamics point of view, we felt it was necessary to raise awareness about the impact that this pandemic is having on mental health, so that we can then be more empowered as we move towards our new normal.
All right, I want to talk about the survey then that you conducted, that you're part of. Talk to us about the samples that you took and who you were able to sort of speak to, as I imagine you would have covered a wide grouping of South Africans and not specifically focused on one specific group, for example. So how did you really conduct this survey so that it would really be reflective of South Africans?
So we try to keep it to adults. So there was an age restriction from 18 and up, and we did we took samples from all over South Africa in terms of the different provinces, and in that way we could then have a as wide as possible net that we were asking the questions to.
We understand that many people who previously were sort of able to cope well with stress are now less able to manage due to multiple stress factors or stresses generated by the pandemic. Can you talk to us about that?
Yes, so the various factors, like you said, have been contributing to this increased level of stress and anxiety, especially during this time. Just to give you a couple of examples, more than half of the individuals that we interviewed either had to take a pay cut, was forced to lose their job, or forced to close a business. So the financial implication is one of the big factors. Other than that, more than half of the respondents also knew someone personally who actually passed away from COVID-19. So that concern, am I going to be next or not, is definitely something that is contributing to the increased levels of stress and anxiety. And the concern from our point of view is that this can lead to mental illnesses such as depression and anxiety as things move along.
Yeah, the other day I was listening to a WHO briefing, and Dr. Tedros said something quite interesting. I'm just trying to remember his exact words, but it was along the lines that mental health is a part of health that is very much neglected by very many countries. And would you say that is the case even here in South Africa? Is there a huge neglect of mental health issues? I mean, the fact of the matter is that this is now becoming deadly and adding to already the coronavirus, which is deadly. So we can attach it to the pandemic. And so is it true to say that we are neglecting mental health issues, and what should be done to kind of pay attention more to them? What should government be doing for example?
I definitely have to agree with you on that statement. Just to give some background, in terms of the WHO, they have a certain recommendation in terms of the amount of budget that needs to be allocated, ideally towards mental health. And that recommendation is 10%. We as South Africa, we are sitting at 5% at the moment. This is due to various factors. We in South Africa, we have a lot of issues that we need to cover, and only so little resources, so it needs to be stretched. But in this example that we're talking about now, we can see that especially during the COVID-19 pandemic, the increased need for mental health services is definitely putting a strain on our system at the moment.
Yeah. What's the best way to, give support? I mean, we can't always kind of be saying that the government has to deal with a particular situation. I mean, how do we help ourselves and help others, perhaps, that we might think are in very highly stressful situations? And really, for someone who's listening to this conversation right now, who's thinking, I'm particularly stressed, where do they begin? And I think that might be one of the biggest issues, because people don't necessarily know where to start.
Yes, I think another one of the biggest issues when it comes to mental illness is stigma. And one of the ways that we can fight that is through education and through educating ourselves, so that we can recognize those signs and symptoms that we need to be able to identify, not only in ourselves, but also in those around us. One thing that is important to remember is that someone who is going through a depressive episode, for example, is not always able to identify these signs and symptoms in themselves. Some examples of that is constantly feeling of hopelessness and despair, substance abuse, persistent trouble sleep, suicidal thoughts. All of these things are signs that can lead to mental illness. There are various resources online. One of them being the Pharma Dynamics website, which is letstalkmh.co.za. And for those individuals who do feel that it's necessary for them to speak to a professional, there is a SADAC helpline, SADAC being the South African Depression and Anxiety Group. And they have a toll-free helpline, which is available 7 days a week from 8 a.m. to 8 p.m. And it's manned by trained counselors. And the number, if I can just share it with everyone, is 0800 205 026.
Okay, thank you very much. I'll try to repeat that number. You said 0800 205 026, correct?
That is correct.
Abdurahman, a pleasure speaking to you. Thank you so very much for giving us your time here on SABC News. We appreciate it.